Hi, I'm Lily Goodsell and my partner was Olivia Pino. Our project was on amyotrophic lateral sclerosis, or otherwise known as ALS. Every day, an average of 15 people are newly diagnosed with ALS, more than 5,600 people per year. One of the reasons I chose to research more about ALS is that back when the ALS Ice Bucket Challenge was popular, it was my first time hearing of the disease, and I never really knew much about it, so I thought this would help me learn more. Symptoms of ALS really depend on which neurons are being affected, so the signs tend to differ from person to person. Most often, ALS begins in the limbs and spreads to other parts of the body. As the disease continues to control the body, the nerve cells become destroyed and the muscles weaken. Earlier symptoms tend to relate more to muscle weakness, and problems with breathing and speaking come later as the disease progresses. Overall, actions like chewing, swallowing, speaking, and breathing can be affected. Bladder control and senses are not usually weakened, and pain is not very common with ALS. There are established and environmental risk factors for ALS. Heredity is one of the established factors. 5 to 10% of people with ALS have inherited it. If you have familial ALS, your children have a 50% chance of getting it. Another is age. ALS is most common between the ages of 40 and 60. Risk of ALS increases with age. Gender is another risk factor. Before the age of 65, males are more likely to develop ALS than women, but after the age of 70, the difference disappears. The last established factor is genetics. Certain genetic variations might make people more susceptible to ALS. There are also some environmental factors that could possibly trigger ALS. Smoking is really the only likely environmental risk factor. However, exposure to lead or other substances in the workplace or at home might be linked to ALS. Studies have also shown that people who have served in the military are at higher risk of ALS, but it's unclear what about the military might trigger it. Some factors might be exposure to certain chemicals, traumatic injuries, viral infections, and intense exertion. ALS is difficult to diagnose because it can mimic other neurological diseases, but there are tests to rule out other conditions. Since these tests only rule out other conditions, patients are often diagnosed by a detailed description and examination of their symptoms. So, patient history is very important. If the patient has upper and lower motor neuron symptoms, then this is a strong indicator of ALS. ALS can be ruled out using an electromyogram. This is a needle electrode that is inserted through your skin into different muscles to test for the electrical activity of your muscles when they contract and relax. Abnormalities can help doctors diagnose or rule out ALS. A nerve conduction study measures the nerve's ability to send impulses throughout your body. This test can determine if you have nerve damage or certain nerve or muscle diseases. An MRI produces a detailed image of the brain and spinal cord using radio waves and a magnetic field. This can reveal tumors, herniated discs, and other conditions. Blood and urine tests can also be used. Analyzing samples of these can help doctors eliminate other possible causes of symptoms. The spinal tap involves using a small needle inserted into the lower back, which removes a sample of spinal fluid to be tested. Another test that can be done is a muscle biopsy. A small portion of your muscle is removed and sent to the lab. This is done when the doctor believes you have a muscle disease other than ALS. ALS attacks the motor neurons in the body. There are two types of motor neurons, upper and lower. Upper motor neurons go from the motor cortex, the part of the brain that controls movement, to the spinal cord. Lower motor neurons go from the spinal cord to muscles throughout the body. Motor neurons are the longest cells in the body. Each of them extends a connecting fiber called an axon to the next neuron or organ. Normally, neurons move cellular materials along their axons to keep cell messages flowing and to maintain the health of the whole nerve cell itself. Active transport along the axons allows materials to reach the farthest nerve endings and for nutrients to be delivered back to the cell body. Cells that don't receive the proper materials will die through apoptosis or programmed cell death. There are the other cell types in the central nervous system that support motor neurons which are affected as well. These cells are called glial cells, which include astrocytes and oligodendrocytes. Mitochondria, a type of cell organelle, are also very important. They help in providing the energy in the form of ATP needed for a single cell to send a signal from the spinal cord all the way to a person's fingers and toes. Another essential part of sending nerve signals are neurotransmitters. Nerve cells pass signals to each other by releasing these messenger molecules, which then tells the next nerve whether to release their own neurotransmitter. Several pathological processes can play a role in the cause of ALS. A few include mitochondrial dysfunction, excitotoxicity, and SOD1 mutations. Mitochondrial dysfunctions have been found to play a role in the motor neurons' death associated with ALS. Mitochondria from patients with ALS have been found to have an impaired level of calcium ions and an increased production of reactive oxygen species, otherwise known as ROS. ROS has been associated with oxidative-related damage by changing the composition of different proteins. Excitotoxicity plays an important role in the cause of neuron cell death as well. Excitotoxicity is the degeneration of neurons due to overstimulation of glutamate receptors. In addition, the genetic alteration associated with ALS changes an abundant enzyme known as SOD1. The toxic effects of SOD1 are a result of the failure of proteins. SOD1 converts reactive oxygen to water and contains a copper ion and zinc atom to carry out chemical changes. In ALS, evidence shows that the disease is not caused by the loss of enzyme activity, but that the mutation causes SOD1 to gain a toxic property. Mutations causing the loss of the function of the gene lead to loss of motor function. Unfortunately, there is no treatment to reverse the damage of ALS. However, they can slow the progression of symptoms, prevent complications, and make you more comfortable. 2 medications have been approved by the FDA to treat ALS. These include riluzole and edaravone. Riluzole works by protecting the upper and lower motor neurons from exposure to too much glutamate, which may be part of the cause of nerve damage. This medication has been shown to increase life expectancy by 3 to 6 months. It is taken orally and can cause side effects such as dizziness, gastrointestinal conditions, and liver function changes. The other drug, edaravone, works by relieving the effects of oxidative stress, which may be related to the death of motor neurons. Edaravone has been shown to reduce the decline in daily function. It is given by intravenous infusion and can have side effects including bruising, headaches, and shortness of breath. There are also other medications that can be prescribed to provide relief from the symptoms of ALS, such as muscle spasms and pain. Another form of treatment that can't reverse the damage of the disease but can help make the patient more comfortable is therapy. Many therapies can be done, including breathing care, physical therapy, occupational therapy, speech therapy, nutritional support, and psychological and social support. ALS is a disease that is affecting as many as 30,000 Americans as we speak. However, ALS affects people throughout the world. ALS can strike anyone. The average life expectancy is only 2 to 5 years after the time of diagnosis. There are many people and organizations such as the ALS Association who commit money and time to find treatments and a cure for this disease. Thank you.